Welcome to the Deep Dive, where we unpack a stack of information just for you.
It's great to be diving in again.
Today we're taking a deep dive into sources covering vitamin D and its crucial, sometimes really surprising role in the health of older adults.
Yeah, we've got quite a mix here. Articles, research reports from various studies.
And our mission, as always, is to sort of cut through the noise, pull out the most important insights, those surprising facts, key connections, and maybe some actionable knowledge.
Specifically looking at the elderly population this time.
Exactly. Okay, let's get into it. Let's unpack this and see what's really going on with vitamin D as we age.
Well, what's fascinating, I think, is how often we just think vitamin D, okay, bones.
Right.
But these sources, they really broaden that picture, show its reach, especially later in life.
Totally agree. And that seems like the perfect place to start our journey through this material. So what is vitamin D, really? And why does it become so much more complex and vital as we get older?
Well, fundamentally, it's actually classified as a steroid hormone in the body.
A hormone, okay.
Yeah. And while its best known role is absolutely essential, bone mineralization, supporting the skeletal system.
Which is crucial.
Absolutely. But it really doesn't stop there. It acts as an important systemic hormone, influencing, lots of other areas.
Okay, here's where it gets really interesting, based on these sources. They highlight its involvement in things I might not have immediately connected, like muscle strength.
Muscle strength, cardiovascular health,
Yeah.
immune function.
Neurological processes too, right? And obviously calcium and phosphorus metabolism.
Which ties back to the bones, yeah. Intestinal calcium absorption, and even the ongoing process of bone growth and remodeling.
So it's working across the whole body, really.
It truly is. And when you think about what this means specifically for older adults, the sources are very clear. The risk of deficiency, it goes up significantly with age.
And it's not just one thing causing that.
No, it seems to be a combination. You've got age-related physical changes, common lifestyle factors, and also the increasing presence of chronic illnesses.
So maintaining good levels isn't just about one benefit.
Right. It appears fundamental for overall well-being and potentially preventing a whole range of issues in this age group.
Okay, so if it's that crucial, where do we actually get it from? What are the main sources?
Primarily, it's sunlight, UVB radiation hitting the skin. That's estimated to account for, up to 90% of our vitamin D needs.
90%? Wow, that's huge.
It is. A much smaller portion, maybe 10 to 20%, comes from what we eat, our diet.
And the dietary sources mentioned, there are things like fish oil, fatty fish, liver.
Egg yolks, butter, and fortified foods that many people know, like milk, some dairy products, cereals.
The sources even mention some plants. Parsley, nettle, sweet potatoes.
Right, though likely in smaller amounts.
Yeah.
But that main source, the sun synthesis, it's incredibly sensitive to a lot of different factors.
Like where you live.
Exactly.
Yeah.
Your geographical location, latitude, the season makes a big difference, the time of day.
Skin pigmentation plays a role too, doesn't it?
It does. And age itself, how much skin you actually expose,
Right.
how much sunscreen you're using.
Right. Even clothes and just how much time you spend indoors, which can be a lot for some older adults.
Definitely. And on the diet side, absorption from the gut can decrease with age. Or if someone's had certain procedures like gastric bypass surgery.
Gotcha. So when we talk about vitamin D status, how is that actually measured?
Usually it's by measuring blood levels of a marker called 25-OHD.
Okay.
And the sources lay out the typical definitions. Generally above 30 nanograms per milliliter, SPGLL, is considered sufficient.
And below that?
Though insufficient is often defined as 21 to 29 NGLA.
Yeah.
And then deficient is typically below 20 NGLL.
Okay. And the numbers. The prevalence of deficiency, especially deficiency, they're pretty striking, aren't they?
They really are. Worldwide, deficiency that's below 20 NGLA is incredibly common. We're talking potentially affecting 30% to maybe even 90% of people globally.
1 billion people, the estimate says.
Around that, yeah. But what's really critical for our deep dive today is that it's more common in the elderly compared to other age groups.
And the risk goes up the older you get.
Undeniably. Look at these statistics from the sources. Around, say, 33.4% deficiency in the general elderly population.
Okay, still high.
But then it absolutely skyrockets,
Yeah.
figures between 78% and 98% among elderly individuals living in nursing homes.
Wow. 78 to 98%, that's almost everyone in some settings.
It's staggering.
That really brings us to the core question then. Why? Why are older adults so much more prone to this deficiency?
Well, according to these sources, several key factors, both physiological and lifestyle, kind of converge.
Oh.
First, there's research suggesting that simply as we age, our skin, its actual ability to synthesize vitamin D from sunlight, decreases. That's been known for a while.
And mobility is a big one, right? Spending more time inside.
Absolutely.
Yeah.
Studies highlight that. It significantly limits that crucial sun exposure needed for production. Plus, as we touched on, that decreased intestinal absorption with age can be a factor for dietary intake. And there can also be age-related issues or medical conditions affecting the kidney's ability to convert vitamin D into its most active form, as particularly linked to chronic kidney failure.
Right. And then you layer on top all those external things we mentioned, skin pigmentation, where you live, season, time of day.
Sunscreen use.
Yeah.
The sources point out even SPF 8, if used correctly, can slash synthesis by like 95%.
95%.
Yeah, and just covering up with clothing, it all adds up.
And certain medical conditions seem to complicate things further.
They do. Obesity is frequently linked to deficiency. Because vitamin D is fat-soluble, it gets stored in fat tissue, making less available for the body to use.
So obese individuals might need higher doses.
The sources suggest maybe 2 to 5 times higher doses for treatment, yeah.
Yeah.
Gastric bypass surgery, that can affect fat absorption. And conditions like chronic kidney failure or being on dialysis directly impair the body's ability to produce active vitamin D.
Are medications a factor too?
Yes, certain ones can interfere. Some anti-seizure drugs, certain antibiotics are mentioned in the sources.
Okay.
And one more thing, the relatively short lifespan of vitamin D in the body, its half-life average is about 3 weeks.
Meaning you need to replenish it fairly often.
Exactly, compared to some other vitamins.
Okay, so low levels are incredibly common, especially as we age, for a whole host of understandable reasons. Now, let's dig into the impacts the sources detail. How does this deficiency really play out in the health of older adults?
Right. Let's start with the musculoskeletal system. That's the most recognized link, and it's profoundly important for aging.
Okay.
Deficiency here leads directly to decreased bone mineral density.
Meaning weaker bones.
Essentially, yes.
Yeah.
A higher risk of conditions like osteopenia and osteoporosis. Reduced bone strength, significantly higher risk of fractures.
And physiologically, what's happening there?
Well, low vitamin D causes decreased calcium absorption from your diet. That then triggers the body to release more parathyroid hormone, which can affect bone.
And the sources really emphasize the preventative side here, don't they, with supplementation?
They do, recommending adequate vitamin D, often alongside calcium. One source notes at least 1,500 milligram calcium daily combined with 400 to 800 IU of vitamin D, specifically for bone and muscle health.
And they cite studies showing actual fracture reduction.
Yeah, showing that around 800 IUs per day can potentially reduce hip and other non-vertebral fractures by about 20%.
That's significant, 20% fewer fractures.
It's a substantial impact on preventing serious injury. And it's not just bones. It also significantly improves muscle strength and performance.
Which links directly to falls, right? A huge concern.
A major concern for older adults. And yes, studies show supplementing with about 800 IU per day seems effective in reducing fall risk.
There was a big U.S. health survey mentioned, NANE's third.
Right. That found insufficient vitamin D intake increased the risk of frailty becoming frail by 3.7 times in adults aged 60 and over.
Wow, 3.7 times.
Yeah. Deficiency is really seen as both a cause and a consequence of frailty. It can even help improve basic things like walking and movement ability.
That muscle and fall risk connection is huge. What about the cardiovascular system? What links did the sources find there?
Well, low vitamin D is consistently linked in these sources to various cardiovascular risk factors.
Like what?
Things like hypertension, high blood pressure, even the kind that's hard to treat. Coronary artery disease, peripheral artery disease, and an increased risk of death from cardiovascular causes.
So studies find lower levels in people who already have heart issues.
Consistently, yes. Lower vitamin D levels are common in individuals already living with cardiovascular diseases.
So just having sufficient levels seems important for heart health overall.
Absolutely. The research suggests maintaining sufficient levels or supplementing if needed is associated with the lower risk of serious events like heart attacks, atrial fibrillation, and overall mortality.
And there was a meta-analysis mentioned.
Yes, suggesting that moderate to high doses, maybe around 1,000 IU per day, could potentially reduce cardiovascular risk. And interestingly, they noted that calcium supplementation alone didn't seem to show that same effect.
Interesting distinction. Okay, shifting gears from the heart to the lungs. What about the respiratory system?
Vitamin D seems to play an important protective role here too. Deficiency is linked to conditions like pneumonia, tuberculosis.
Where levels can be almost undetectable, it says.
Right, bronchiolitis too. And just a general increased susceptibility to viral respiratory illnesses, especially common in winter when vitamin D levels tend to dip.
The sources also note a significant link with COPD, chronic obstructive pulmonary disease.
Yes, lower levels are associated with its formation, how it progresses, and how often patients have those exacerbations, those flare-ups.
Yeah.
And levels are also significantly lower in patients who unfortunately have both COPD and coronary artery disease.
So having sufficient vitamin D might help prevent lung issues or manage them.
It's considered potentially effective for both primary and secondary prevention, yes. Studies specifically highlight the link between low levels and increased risk and symptoms of asthma.
Showing supplementation can help.
Yeah, potentially reducing asthma exacerbations by about 27% and improving outcomes for those with lung dysfunction. Overall lung function has been correlated with vitamin D levels.
And there was even a mention of lung cancer.
In lab studies, yes. The active form of vitamin D showed signs of potentially fighting certain lung cancer cells, inhibiting their growth and spread. And deficiency is also frequently found in patients with ARDS, acute respiratory distress syndrome.
It really seems to touch so many systems. Let's look at the brain. Cognition.
Okay. Low levels are linked to reduced cognitive function and dementia in older adults. Though it's worth noting, the sources do say studies on this cognitive link aren't always completely definitive.
But some research shows a connection.
Yes. Some research does show that severe deficiency is associated with worse outcomes on cognitive tests, even when you control for other factors like age, sex, education, body weight.
And there's suggestion it might influence the underlying biology of conditions like Alzheimer's.
Potentially.
Yeah.
Maybe reducing amyloid plaques. And multiple sclerosis, perhaps affecting nerve protection, inflammation.
Right. The sources mentioned the geographic distribution of MS seems inversely correlated with sun exposure.
Exactly. And a study from Korea specifically looked at healthy aging, found that combining physical activity with vitamin D supplementation was linked to preventing cognitive decline in normal aging.
What about mental health? Specifically depression, which can affect older adults.
Studies do show an association there. Lower vitamin D levels are often seen in elderly individuals with depression.
But is it cause or effect?
That's the interesting question some sources raise. Is the deficiency a consequence of depression? Maybe less activity, staying indoors, rather than a direct cause. Though an observational study of depressed elderly folks with low vitamin D did suggest that supplementation showed some improvement in mood disorders. And the association might vary by season 2.
It really is systemic. The sources mentioned several other potential links too, didn't they?
They did. Eye health, for example. Research is ongoing into its possible role in protecting ocular health. Links to things like macular degeneration, glaucoma.
And the obesity link we touched on earlier seems pretty significant.
Absolutely. Deficiency is very frequently found in people with high BMI. And because it's stored in fat, it might be less available systemically.
Meaning higher doses might be needed for treatment.
Exactly. Potentially 2 to 5 times higher, some sources suggest. And some even suggest a replacement therapy might help reduce obesity itself.
Liver health was another area.
Yeah, supplementation has been observed to help prevent fatty liver in some groups, like middle-aged and elderly Chinese populations. And in chronic hepatitis C, an inverse relationship with liver fibrosis was shown, suggesting potential benefits from treatment.
In chronic pain, that's something so many older adults deal with.
Right. And there's growing evidence suggesting vitamin D supplementation could be beneficial here, possibly through its anti-inflammatory effects.
Any specific examples?
One study on musculoskeletal pain in certain patient groups reported that 90% felt their pain reduced or even disappeared after treatment for vitamin D deficiency.
90%.
Yeah. And in patients with type 2 diabetes who also had nerve pain, polyneuropathy, and low D levels, vitamin D treatment significantly reduced their pain scores.
So some experts suggest just supplementing.
Some suggest considering around 2,000 IU daily for patients with chronic pain, even without checking levels first, potentially.
Interesting. Okay, moving to a really big one, the immune system and infections.
This is a critical area. Numerous studies underscore vitamin D's important role in both our innate immunity, the first line of defense, and our acquired immunity, the more targeted response.
There's a clear link between levels and function.
Definitely. Between 25 OHD levels and immune function. It might play a key role in autoimmune diseases too. type 1 diabetes, MS, inflammatory bowel disease. Diseases whose geography often inversely correlates with sun exposure.
How might it actually bolster immunity? What's the mechanism?
Well, one proposed mechanism for innate immunity is boosting the production of antimicrobial peptides.
Wow.
Think of them as the body's own little germ fighters, helping to kill bacteria. And low levels are linked to significantly higher rates of certain nasty infections, like H. pylori and C. diff.
And in really sick patients.
Critically ill septic patients often have low D levels, which is linked to low levels of these antimicrobial proteins. It suggests vitamin D might be pretty fundamental in helping the body control infection.
What about viruses like HIV?
Low levels in HIV patients are linked to increased mortality. Vitamin D might help boost certain immune cell functions and potentially have some antiviral activity.
And supplementation might help reduce inflammation.
Yes, suggested to suppress inflammation, increase overall antioxidant capacity, lower markers like CRP. One source even mentioned low levels in premenopausal women being linked to recurrent UTIs, suggesting oral supplementation might be an alternative prevention method.
Okay, let's tackle cancer. This seems complicated given the sun exposure linked to skin cancer.
It's definitely a nuanced area, you're right. In lab and animal studies, the active form of vitamin D shows, well, promising potential.
How so?
It seems it can stimulate cancer cells to self-destructive apoptosis and inhibit their growth and spread, particularly noted in breast cancer models.
And there's evidence in humans, too.
There is evidence suggesting a role in prevention or positive effects when replacing low levels, yes.
The sources mention ecological studies comparing sun exposure and cancer rates.
Right, showing an inverse correlation between solar UVB exposure and 15 types of cancer, including common ones in the elderly, like colon, prostate, and breast.
But is it proven for prevention, say, in colorectal cancer?
Not definitively settled, no. But increased dietary intake was linked to an 11% reduction in the risk of precancerous growths, adenomas.
And there were some pretty strong suggestions for breast and colorectal cancer reduction with supplementation.
Yes, evidence from North America suggesting 2,000 IU per day could potentially reduce breast cancer incidence by 25% and colorectal cancer by 27%.
Which translates to huge numbers of cases potentially prevented.
Tens of thousands annually in the U.S. alone, one estimate suggested for breast cancer.
And that meta-analysis of randomized trials, what did it find about cancer death?
That large analysis linked supplementation again, often around 2,000 IU day, to a 13% reduction in cancer-related death over 3 to 10 years.
13% reduction in cancer mortality.
Suggesting widespread supplementation could be broadly beneficial against dying from cancer.
What about prostate cancer? The picture seemed a bit different there.
It is interesting. Low levels seem to increase risk, moderate levels seem protective. But very high levels are also linked to increased advanced prostate cancer risk. So got a U-shaped curve, perhaps.
And let's circle back to that skin cancer question. How do we reconcile the sun link?
It's a critical point. Skin cancer is absolutely linked to sun exposure, no question.
But
studies haven't found a link between vitamin D intake from diet or supplements and an increased risk of skin cancer.
okay, that's important.
And some studies even note that the deadliest type, melanoma, often occurs on body parts less exposed to the sun, even in people who work outdoors. Plus, high-dose vitamin D has shown potential to slow tumor growth in vivo, and related compounds are actually used topically to treat skin conditions like psoriasis by affecting skin cell growth.
Right. Okay, finally, the sources touch on mortality itself, the ultimate impact.
Yeah. Studies comparing vitamin D levels and death rates consistently show an inverse relationship. Higher 25-OHD levels are generally linked to lower risk of death from all causes.
One study found a specific range with the lowest rates.
Yes, finding the lowest death rates at levels between 20 and 24 ng/ml, showing a sort of reverse J-shaped association. The idea is adequate levels are linked to delaying aging processes, while consistently low levels might contribute to premature mortality.
And low levels were an independent risk factor for cancer death in older women.
Specifically, yes. And levels below 50 ng/ml, that's our 20 ng/ml deficiency cutoff, were strongly linked to death from any cause within 10 years in women over 75.
Wow.
Some estimates even suggest significant numbers of premature cancer deaths yearly in places like the US and UK could be linked to inadequate sun exposure, potentially affecting 13 different cancer types.
Okay. So, given how widespread this deficiency is, especially in the elderly, and its potentially profound impact across so many systems, what do the sources suggest we actually do about it? How can this be addressed?
Well, the main strategies highlighted are pretty clear. Increasing intake through diet, getting controlled sun exposure, and using supplementation.
Right. Diet, as we said, is only a small part, 10–20%.
Yeah, so sun exposure is the main natural source. The recommendation is often for regular short periods, maybe 10 to 15 minutes, 2 or 3 times a week.
On exposed skin. Arms, legs.
Right. Arms, legs, back, abdomen. Apparently the face isn't very efficient. During optimal UVB times, like midday, 11 a.m. to 3 p.m., and importantly, without sunscreen.
But that comes with big caveats, right? Especially for older adults.
Crucial caveats. You absolutely have to consider individual factors, skin type, skin cancer risk. Remember, sun-through glass doesn't work. Sunscreen blocks it.
And the risks of heat for older people. Dehydration.
Exactly. Headache, dizziness, nausea, rapid heart rate. Need to be very careful. But encouraging safe time outdoors, especially in summer, with appropriate clothing and mindful, short exposure is still seen as important.
So supplementation sounds like a really crucial strategy then, especially when sun exposure is limited or risky.
It really is presented that way. Dosage recommendations, they do vary a bit, but maintaining blood levels generally between, say, 28 and 40 ng/ml is suggested to maximize those non-skeletal benefits we talked about.
Is there an estimate of how much supplementation that might take?
One calculation suggested that going from deficient, like 2010 mol, up to sufficient, maybe 82 in mol, might require daily supplementation around 2200 IU.
Okay. But there's no single perfect dose agreed upon for everyone.
No complete consensus on the optimal daily dose without any risk of toxicity. Suggested safe upper limits vary. Toxicity is generally considered way up, like blood levels above 150 ng/dL.
And for specific things like that chronic pain link, some suggest starting with 2000 IU.
Yeah, potentially, even without checking levels first, according to some sources. Vitamin D3 cholecalciferol is generally the recommended form.
With or without calcium.
Often without added calcium is preferred for generally healthy people, unless their calcium intake is also low. But definitely need caution in patients with conditions that raise their risk of high blood calcium sarcoidosis, some kidney diseases.
Makes sense. It seems healthcare professionals, especially those working directly with older adults like public health nurses, they play an absolutely vital role in this whole picture.
They really do. According to these sources, they're key educators, helping older adults, your caregivers, understand why vitamin D is important, how to approach safe sun exposure, what foods help.
Identifying who's at higher risk.
Exactly. And promoting beneficial lifestyle factors too.
Like exercise, balance, resistance training.
Yeah. Dancing, climbing stairs, walking things to strengthen bones and muscles, and advising on reducing tobacco and alcohol, which we know weaken bones and affect calcium.
So they're advocates too, pushing for testing, advising on supplements.
Absolutely. Their roles are broad: caregiver, educator, counselor, even researcher and agent of change. They might specifically suggest that 400, 800 IU vitamin D plus the 1500 milligram calcium for bone muscle health. They help raise awareness of deficiency symptoms, related diseases for earlier diagnoses, and to stress the importance of checking levels in a simple way.
So while these sources shed a ton of light on vitamin D and aging, does the research still point to gaps, areas where we need to know more?
Yes, it does seem so. While the relationship is much clearer, there are still unknowns. The sources acknowledge there isn't yet one single universal guideline for screening and treating deficiency that fits every older adult perfectly.
Leaving some uncertainty.
Yeah, about the specifics, who needs supplements, what dose is ideal for their specific risks, how often to check levels for everyone. More comprehensive, multidisciplinary studies are still encouraged to really nail down those details.
Wow. Stepping back from all this detail, it's just incredible, isn't it, to think about this one single hormone and how it could impact so many different parts of health as we age.
It really is, from the absolute basics like bone strength and fall risk.
Right, to heart health, breathing, brain function, immunity.
And potentially even influencing things like cancer and how long we'll live.
It really hammers home that addressing vitamin D deficiency in older adults, well, it isn't just about preventing fractures. It's a systemic issue with really widespread implications for truly healthy aging.
Yeah.
And the sources consistently emphasize that multi-pronged approach, don't they? Diet, smart sun exposure, where feasible and safe, and targeted supplementation.
All supported by knowledgeable healthcare professionals guiding the way. That seems key.
What's truly fascinating here, I think, is the sheer scale of the potential impact.
When you consider just how common vitamin D deficiency is in the elderly population, remember those staggering nursing home statistics?
Yeah, 78 to 98%.
Right. It makes you wonder. And this deep dive really raises an important question, maybe for you, the listener, to ponder. If we as a society adopted a more proactive, widespread approach to making sure older adults had optimal vitamin D levels. How fundamentally could that change the experience of aging for millions of people?